Welcome back to Belger Veterinary Hospital. I'm Dr. Krista Vernolican.
Hi, and I'm Dr. Lindsay Renzullo.
This is Lucy, my dog, here to help us talk about pets and their dental care. So February is Pet Dental Health Month, and we like to talk about dentistries during this month, but really it's important to think about dental health all year round. It's just that this month is a good time to raise awareness of the issue. So, I feel like the most common thing that I hear from a lot of owners is, there's no problem with my pet's teeth. I don't need to do anything because they're eating. So do you hear that from your owners?
I hear it a lot, and I feel like it's a very good point. But a lot of times if your pet stops eating because the pet's dental health is that bad, the dental disease has progressed pretty significantly. So a lot of times what we try to do is we try to focus on prevention. And so making sure that we're getting to our pets and cleaning those teeth and making sure that we're taking care of the dental health before it gets to the point where they actually stop wanting to eat their food. So there are a few things that you can do at home with your own pet, as well as you can discuss with your regular veterinarian as well to help figure out if whether or not your pet needs to have a dentistry or have other modalities to help clean its teeth.
So one very important thing that owners can do is actually to look at their own pet's mouth, which we often don't do. You can look at their teeth really much more closely than you normally would. You can see they have 42 teeth. Cats have 30. We can look at their incisors, their canine teeth, and the teeth in the back of their mouth. You really have to lift up their lip and take a look. Most of the time, what you're looking for is that your pet's teeth look very much like your own. You should have nice pink gums. We should have white teeth. Not a lot of tartar on them. A little bit of tartar is okay, but we shouldn't have beet red gums. We shouldn't have tartar that's covering multiple teeth and you can't even see the difference between the teeth. What else?
And smelling the dog's breath is always important. That's another big complaint I'll get from clients is their dog's breath smells. And sometimes it's just regular doggy breath, and other times it can indicate more significant dental disease.
So you can provide care for your pet's teeth at home by many different measures. The most important thing would be brushing. If you can, not every dog or cat will accept it, but when they will, it really is by far and away, just like in your own teeth, the best way to take care of their teeth. So what do you think about toothbrushes?
I feel like there's lots of different toothbrushes on the market. We have veterinary toothbrushes that are available, but even sometimes like pediatric toothbrushes that you can just buy at CVS work just fine as well.
They have little finger ones that you can go in there with. There's a lot of different ways to manage it. The first thing is kind of getting them used to the toothpaste and the toothbrush. So you don't have to rush this. Put a little bit of toothpaste on your finger. It should be dog or cat specific toothpaste, not human. We're not intended to eat that toothpaste. They don't really know. The dog and cat specific ones are also flavored. So put it on your finger, let them lick it. Do that for a week. Put it on the toothbrush and let them lick and chew on the toothbrush a little bit. And then you can go in there and start brushing. And you're brushing very similarly to what a human would. Again, only focusing on really the outside and the incisor area up here, the canine area up here, and then the teeth in the back.
And I find as best you can make it a happy experience, and if you can fit it into your regular routine, is always the best thing to do. If your pet is really hesitant or is not really into it or for whatever reason is getting very frustrated, to try to keep pushing through sometimes actually makes it harder the next time you actually give it a go. So make sure lots of treats, make sure it's really a happy experience.
Yeah. And if you can do it daily, just like our own teeth, daily is great. Every other day is also good. Less than that, less effective, but certainly starting where you can start is a great idea. And then, other things that you can do, there's actually a wide variety of things that you can add in there if your pet doesn't like toothbrushing, or in addition, there's foods, there are treats, there are water additives. All of these things, we recommend getting a product that is approved by the Veterinary Oral Health Council, which is vohc.org. And they just have independently reviewed the products to make sure that they actually meet their goals.
For our next pet health segment, we would like to discuss pregnancy and your pets at home, and not necessarily pregnancy in your pets, but pregnancy for you. I am 7 months pregnant, so I thought it'd be a great topic to discuss, things that you need to do to take care of yourself and your animals while you are pregnant.
So, saying goodbye from Belger Veterinary Hospital, I'm Krista.
I'm Lindsay. Thank you so much.